Today we are talking about type 2 diabetes mellitus. We're going to start in the top left of our slide here. Type 2 diabetes is a non-communicable chronic disease characterized by hypoglycemia, high blood glucose levels. This can lead to serious complications. In type 2 diabetes, the body's ability to produce and use insulin is compromised. Insulin is a hormone that's essential for regulating blood sugar. So insulin resistance, a hallmark of the condition, occurs when cells in the body become less responsive to insulin, deeming it less effective at facilitating glucose use as energy in the body. Initially, the pancreas increases insulin production by its beta cells. However, it struggles to keep up with the demand, and eventually the beta cells become overworked and fail. So this imbalance or mismatch between insulin supply and demand leads to hypoglycemia, which, if uncontrolled, can damage tissues and organs. Moving on to the disease impact and really looking at the key bullet points there, we see that type 2 diabetes is on the rise globally and nationally, aligning with obesity rates. Early onset, that is 40 years and younger, is also on the rise, with marginalized groups bearing disproportionate burden. Below that, we can see some figures for global and national disease prevalence as well as burden. Globally, we have over 747 million adults with type 2 diabetes. That's approximately 9%. And approximately 4.6% in Australia. That's 1.2 million. It's responsible for global daily count of 66.3 million, and in Australia, 128,000. This is equating to a growing problem, and projections predict that it will continue growing. We can see the economic impact in the bottom left there. The annual healthcare cost in Australia alone was 2.3 billion in 2021. What does this mean on a local and individual level, though? Strain on community health services, with patient loads increasing and need for specialists and caregivers. Absenteeism also is on the rise in the workforce, with individuals reporting low quality of life. And part of that is this estimate report that the average annual cost for someone with type 2 diabetes is $4,390. Risk factors include non-modifiable and modifiable. Some of those non-modifiable are race, ethnicity, age, and family history. Modifiable, we see body weight at the top of the list, unaddressed high blood pressure, behavioral factors like smoking, alcohol, physical inactivity, as well as diet. Moving into prevention, straight from the Australian National Diabetes Strategy is the top two bullet points. We're looking to reduce modifiable risk factors, the ones that we just spoke about. That's eating healthy, decreasing body weight, and more physical activity. We also want to identify high-risk individuals and proactively look for some early-stage management for them. I really want to point out the lifespan perspective as an important one. It's really saying that just asking people to lose weight and exercise more is ignoring a complex interplay of various levels of influences in their lives. They're saying, or lifespan perspective says, that in addition to proximal factors, societal and genetic determinants need to be considered when we're looking at broader prevention strategies. So why did I choose type 2 diabetes for this assignment? Well, as a Pacific Islander, I've had many personal experiences with type 2 diabetes. Less than 2 years ago, my mother passed away due to this disease. At the time, I was shocked, and I became brutally aware of my lack of what I know now is health literacy. So this catalyzed me to start studying health science as an undergrad here at WSU at 40 years old. But despite my personal lack of health literacy and understanding of Pacific Island health issues, I realize I'm still privileged as a first generation migrant I'm educated enough to take on this. I'm also supported enough to take on this learning opportunity, and I hope to do work in non communicable disease prevention for many years to come. There's so many research questions I like to pursue answers to, but knowing that diabetes prevention relies greatly on individual adherence to lifestyle changes, and having seen a lot and read a lot of research this past year on barriers, then drawing on my personal experience, I realized I don't see much culturally specific research um, in the academic journals. So I would like to ask, how do cultural practices and beliefs influence physical activity and dietary choices among Pacific Islanders?